My name's Aaron Leafley and I work on the HSCIC dataset at the HSCIC. So I'm going to briefly try and whiz through my slides, and I want to save a bit more time at the end for some questions to understand what are some of the concerns with clinicians and informaticians. What are the key issues that are either preventing you from submitting data, or so what are the general data quality issues that you can be aware of and help you with. So just to give you the current position, the data set went live for collection from the 1st of January, and the first submission of data for January was actually received in February. So the window for January provisional data was the 23rd, and that window closed on, the window closed on the 23rd. And then on the 1st of March, the window's reopened again for January refresh data and February primary. So what happened when the first window? Well, we had 80 providers actually successfully submit a file, which was a lot higher than we was expecting. That's a lot more submissions than we had with the previous data set, which was adult only. So that does suggest that some CAMS only services have started submitting. So we've got 80 providers submitting data, but we've actually know of 27 other providers who haven't yet been able to make a successful submission, but we know they're actually working on it. So we've got 10 who haven't yet registered on the portal, but they are aware of the requirement and they are working to get access to the portal and create a file. And we've also got 17 who are registered on the portal. 14 of them have not actually tried to submit, but 3 of them have submitted, but just they haven't been able to get the file through. So that's the current position. It's not entirely 100% complete. We are aware of other providers who they're not necessarily on our radar at the moment, but we are actively chasing. So we've been working with CQC and NHS England to try and identify some of the services that have never submitted before, either adult activity or child activity, and just understand, are they actually in scope of the data set? And if they are, what is the current position, why they're not currently submitting? So there's 65 providers on our radar. And I was hoping today that maybe if we provided a list to maybe Alex and Rebecca, we could share it to the collaborative, just to make sure that our list is actually up to date. So if you haven't submitted and would like some support, just make sure you're on our radar. Because we are, at the moment, over the last couple of months, we've been trying to phone providers and get in touch with the IT teams and just check the status and improve our coverage overall. So we have been providing support to providers. There's a lot of content on our website, but we also provide sort of a telephone help desk and an email help desk as well. So we've been bombarded with queries over the last sort of 6 or 7 months, which is good. I'm not necessarily sure we've had as many as we probably should do from sort of CYPI Act area and CAMS area. So we've got an email address you can feel free to contact us with, and we've got a website, the MHSDS webpage, and there's a lot of documentation on there. So it does take a bit of time to actually read and understand the requirements and how to use the portal and what data goes where. But there's certainly a lot to read and a lot of guidance available. Some of the queries we've received from the CYPI programme are to do with consent. So what we've done is we've published a new guidance document. This was only available maybe 3 or 4 weeks ago, so maybe not everyone has seen it yet. But it's basically a leaflet that contains information that services can use to communicate with the service users. So it tells you about the data set, so what is the data set, why we're collecting the data, what we're doing with the data, what are the benefits ultimately, and how are we going to make sure that if we collect information about a service user, how are we going to protect it? So there's a lot of questions that your service users may ask, and hopefully that guidance will be able to allow you to produce your own leaflets or posters. So that's been sort of a common query we've received. Another document we've recently added is to do with a portal. So the timescales have been quite challenging for us as well. So the portal isn't necessarily 100% perfect. So we've got a document that just explains some of the quirky bugs that go on, and that might explain where you've lost the record you weren't expecting, or one of the buttons isn't working on the system. So I would recommend reading that, maybe just before you contact us, to see if explained in that document. Our user guidance, again, we received sort of, I think we received over 200 queries over the last 4 weeks. So that gives you a scale of the stakeholder engagement. And we constantly try and update our guidance to reflect scenarios, and if you've got a question about SNOMED code lunch, we'll try and add some new guidance to help you understand it in more detail. So please do continue to submit queries, and we will try to respond in our guidance and to yourself directly. Our technical output specification, we're constantly updating the technical processing of the data. So if someone says, we've got this situation that you're rejecting, but it's actually clinically appropriate, we'll make sure we amend it so it's allowed to flow. So what the end result is, everybody's file is consistently processed, and the same data is flown, so it allows us to really benchmark submissions. We produce a monthly newsletter, which I would really recommend you sign up to receive the email notifications for. Our newsletter contains loads of stuff about not just how to submit the data, but when the reports are going to be out, what's going to be in the reports, and link to sort of wider HSCIC considerations as well. So if you email our team support, we'll be able to add you onto our contact list and you'll receive them notifications. I just want to really quickly mention, I know everyone's working on the current data set, but we are looking to make some amendments in April, and one of the feedback we received from NHS England is that they'd like to be able to distinguish eating disorder teams more in a much more granular level. So there's an eating disorder code in the data set for the team type, but they want to be able to separate community eating disorders for children and young people. So if anyone's got them services, you can now reflect them more accurately in the data. And we've added a couple of other items that if you've got an inpatient service, we just want to know whether the ward is locked or unlocked. So it might not necessarily apply to everyone here, but you will have to use a new access database to submit your files from maybe May or June, depending on whether we, how we work out the timetable, but we'll communicate that. So that's MHSDS 1.1, so it is a minor amendment to the data set. And going forward, what we're looking to do is every year, on a sort of an annual refresh cycle, is every April we're going to look at amending the data set to either collect some new and interesting data items or maybe remove a data item we're not actually using. So hopefully if we have an annual refresh every April, it'll allow local users to sort of plan their system changes or their extract routines. And we always provide an implementation guidance to help providers understand how to implement the changes. So I would recommend having a good read through that, especially for 1.1, which is coming soon. So my background is looking at the data set and what are the requirements to collect. So I'm not necessarily an analyst, but I'm going to try and hopefully just cover some of the key questions about how the data is going to be used to start with. So it's a national data flow, and there's 3 sort of established routes to access the data. So what we'll do is the HSCIC will produce formal publications, and they'll be sort of on a monthly and a more detailed annual basis as well. And as I mentioned earlier in this morning's session, we are looking at introducing an interactive tool called iView Plus. It's currently being trialled for the maternity data set, and we're looking at adding the children's community services data set into that as well. And what that will allow is the data that you submit will be loaded into the tool, and it's free for anyone to use. You can register for more functionality, but it allows you to slice and dice and produce your own dashboards locally. You can filter it by CCGE or provider or local authority, and it'll be sort of an iterative process where once we've assessed the data quality of a certain table, we'll add it, and as we go through, all of the data set will eventually be made available for analysis. There is an iView demo on our website somewhere, but I don't think I've got time to necessarily go through that in too much detail. So if you do want to drop an email to our inquiries help desk, they will be able to talk about the iView in a bit more detail. The second route is through the extracts that we've provided directly from the portal. So if you've collated your submission file with your data and you submit it, we process it, but we give you that data back so you can see what your data looks like. So if we've removed some data that's from 100 years ago that's not appropriate, we'll let you know that we've removed it, and you'll be able to get an exact copy of your data back, so you can see what your final data looks like that we'll be reporting off. And a similar thing goes to the commissioners as well. So any activity that you populate against a particular commissioner, that commissioner will get that data. I know there's some concerns about that, but we can certainly help facilitate discussions with your commissioner about what's appropriate to use the data for. And the third route, which isn't available for the current data set yet, but adult only, the MHLDDS is currently available, is our data access request service, where researchers and other organisations, NHS England, CQC, can request a national extract of the pseudonymised data to a predetermined specification. So you might not be interested in all of the data, but if you wanted a subset of it, there is a fee associated with that, but it's certainly available as a service. So what is the HSCIC going to do with the data to start with? Our first report is only going to be on the early intervention in psychosis access and waiting time standards. We've had government commitment to meet these standards and provide some data for that. So on the 31st of March we're going to do a publication, and that's going to be at all ages. So any service user who's accessed an early intervention in psychosis service, they're going to feature in that report. And it's going to be looking at the access and how long people have been waiting to make contact with the clinicians. And we're also going to supplement that with a data quality report. So we're going to be looking at key items, NHS number, reason for referral, date of birth. We're going to be just looking at general data quality issues and try and benchmark that nationally. In April, we're going to do a larger release. So this is going to be using January refresh data. So these are going to be final reports. The ones we publish in March are all going to be provisional, sort of experimental. So in April, we're going to have a much larger release with a more detailed data quality report, and we are going to focus on data set wide measures. So the actual data set isn't just CAMS, it includes adults and older people. So what we're going to be doing is we're going to be doing some data set wide measures, and some of them we might be able to provide an age split for as well. And that sort of fits in with a long-term direction. Because it is an all-ages data set, it's going to be an all-ages publication. The number of referrals received in mental health and learning disabilities generally, but we're also going to have separate publications that look in a bit more detail for adult mental health, learning disabilities and CAMS. So each one of them is going to have more sort of topic-specific measures. So some of the priorities we're going to be looking at for children and young people. There is a group established to start prioritising the work. It's got a snappy name of Measuring Children and Young People's Mental Health Outcomes Group. So I don't know what the acronym for that is, but that has been a group that's set up between the HSCIC, NHS England, Department of Health, other organisations to collaboratively come to a conclusion of what the early priorities are, what do we need to be looking at with this data. And that feeds into the larger Mental Health Data and Information Programme Board. So it's good. They've used tranche, but it's sort of going to be a phased approach. It's sort of to do with our resources internally, but also to do with assessment of data quality and what's feasible and appropriate to report on straight away. It is a new collection to the HSCIC, and we do have to, before we make any sort of official publication, we do have to make sure the data's in a reasonable state to draw meaningful conclusions from. So some of the questions that the group have tried looking at are quite general. Who are in contact with services? So we're going to be looking at referrals. So the number of referrals, where have they come from, how many are open, how many have been discharged, quite general things. And then in a bit more detail, why are they in contact with the services? So we're going to be looking at the reason for referral, and then later diagnoses and other interesting things like that. What are the characteristics? We're looking at the current view complexities and interventions, where have they taken place? Is it inpatients or outpatients in the community? Some children are treated on adult wards. We're going to be looking at that in more detail. So there's a lot of questions there that need answering, and The reports will eventually build up to answer all of these questions in an appropriate manner, but to start with we are going to be looking simply to the number of referrals and etc. So as I said, with the publications, a lot of work is still to be done, especially with this new group. So a couple of places I would like to recommend you having a look at are the publication calendar. So that's got all of our publication dates in for the next so many months, so you can plan for when our releases are going to be made. And they also provide a bit of explanation about what's likely to be included in each report. The existing MHLDS reports, that's based on the adult activity that's already been submitted for the last 4 or 5 years. You can get a flavour of how the reports are set up, what the formats look like. It is going to be very similar in terms of it's going to be a readable CSV with an executive summary, another supporting metadata files, so you can get a good understanding of how, when you get hold of the data, what it's going to look like. And as I've said a number of times throughout, we are always open and we do welcome as much feedback as we can to understand the issues you're facing locally. So please, again, submit an inquiry to our contact centre and we'll try and be in touch as soon as we can.
Can I just ask specifically about the ED? When you're going to slice the ED data from community, are you looking specifically at inpatient services, the new specialist ED teams, or just ED treating community?
Is this with a new code, sorry, we're introducing?
Yes, so the eating disorders. So
yeah.
I'm from Sussex Partnership and we have inpatients. We have a high prevalence rate across the community. And we're currently building specialist services. So
yeah.
we have all three in a way, but it is the split you were talking about, the refinement of your data.
Yeah.
Is it going to be looking at those people recorded in our specialist deputy disorder team?
Yeah, so the new code we've added in is for a community eating disorder service for children and young people, the SEDSIP. And that's sort of got a national contracting arrangement, so they want to be able to specifically measure that type of team to be able to differentiate outcomes between that specialist service and sort of generic CAMS and generic eating disorder services. So one of the early steps we've done is just to add a code in that specifically identifies that specialist team. So locally you can allocate activity to that team, and then we'll be able to report on that against sort of generic CAMS, eating disorder services. So I'm sure there'll be a lot more requirements going forward with that, and I know there is some access and waiting time standards being developed for eating disorders. So a lot of work. We'll see how it goes with the data we've currently got, and maybe next April, if we need some further refinement, we can look at doing that.
Thank you.
Yeah. Hi, Stella.
I know you mentioned snowmelt codes, but it's one of my questions for the day in terms of the pointers on the HSCIC website. We've tried a few. We don't seem to gain anywhere as such, so I wonder if you can give a bit more information, if anyone else go anywhere with snowmelt codes relating to assessment tools, the submission of the HSCIC.
So is there a specific issue? Are you struggling to find the codes, or are you struggling to understand how they're used?
Both, really.
Yeah.
With finding the codes, I did try I think 2 of the platforms. One
Okay.
one was Snowflake. Could only find SDQ, couldn't find any other measure.
Okay. I'll just show you on the website where the SNOMED codes are listed. So on our MHSDS webpage, in our technical output specification, bear with me. It's not that big a file. I'll give it a minute. Here we go. So in the technical output specification, there's a tab called MH assessment scales, and all of the CYPI assessment tools are in here with a SNOMED code allocated to them. So if you can see, there's all the current view all the current view scores, and each score has got a SNOMED code. So what we've asked providers to do is submit the SNOMED code, and that tells us exactly what we need to know. We know it's current view, we know it's a contextual problem, and we know it's to do with home. So we've got everything we need from the SNOMED code to be able to report on that data. And we've got a code list as well. So in the data set, in one of the assessment tables, there's the SNOMED tool type code. So you flow the SNOMED code in this data item, and you flow the score. You tell us what referral it related to, and that's what we need for each score or question. So if you fill in a current view, and you want to submit current view to us, you'd have multiple records in this table. So you'd have the same referral ID for each question, you'd submit each question separately, and you'd submit the associated score for that question. And that's essentially just replicating the exact data that was flowed in the CYPI data set. So it's this different format, but the actual content is very similar. So locally, the impact here is, I just want to make it quite clear that you don't have to be SNOMED enabled to be able to flow this data. We've provided the mapping table. So it's essentially a code list like any other data item in the data set. So as long as you can map a particular measure to a particular SNOMED score, you should be able to flow the data effectively.
If you get the raw data from your system that CYPI apps on, you've got to go back to the actual scoring system to work out how it all fits together.
So does it not come out of your system in sort of a format that's easily mappable?
Well, ours does, but when I first did it, it didn't.
Oh, right, yeah.
No, the scoring system.
Like I said, I think there is a lot of work to do locally just to reorganise the format of the data for submission. But like I said, I think we've made the code list available there because there is a larger SNOMED release, and providers that are SNOMED enabled, they'll just happen in the background already automatically. But for those that aren't enabled, there is a bit of work just to make sure that. So if you've got a current view form electronically that's question 1, question 2, question 3, question 4, there just needs to be an extra sort of mapping column that just allocates a SNOMED code. So locally, the clinicians will never see that, but in the background, you're just allocating a code list to your scores. So. I mean, if there's more questions about that, feel free to be in touch and we can try and provide some examples.
Can I ask about non-NHS services and looking to see what they might data?
Yeah.
So in Bexley we're in partnership with a voluntary agency and a local authority team, and currently we're just submitting information. Obviously they're not, it's not on data that they have to send, but they do have data. But there's quite a few issues that we're grappling with. So one would be about an M3 connection, which, the voluntary agency, it's just too expensive.
Yeah.
Probably the local authority. But also about consent, which is actually those young people who are in those services are not consenting, or that implicit consent that their data is going to go off. So I'm just wondering, at this point, it's not huge levels of data, but it's still data.
Absolutely, yeah. There's always been gaps in our current collection, and there's a lot of work to do to identify the gaps and see what support we can provide. It is quite hard when we're talking about data sharing, because a lot of data sharing agreements have to be sort of created locally based on local practices. Yeah. But when you say NHS, non-NHS are not mandated, if the activity is NHS funded, it is actually mandated. It's only if a patient is privately funded that a provider can submit on an optional basis. So as long as it's the funding is the key to whether it's mandated or not.
So we're a third sector providing, we weren't funded by CCG, but we are funded by the transformation monies. So I said to them, if you're going to fund us, we then have to send data to the HSCIC seem for me to pay for an N3 for us, which they're doing. But it's been a huge task in terms of information governance. I've been talking to a colleague of yours, Navin, though.
Yeah, that's right, yeah.
Incredibly helpful guy. I think we're going to put a bit of a guide together for third sector organisations.
Yeah, we did something similar for adult IAPs, because a lot of adult IAP services were moving to smaller independent services or GP practice-based submissions, and they've in the past never had the IT capacity to make a submission. So we have put a pack together for adult IAP services where you can either create some sort of data sharing agreement and allow a larger NHS trust to submit on their behalf, or there's a few options that we can maybe take some lessons from that and apply it to CYP Act. So we can certainly look into that in a bit more detail if that's a wide-ranging issue.
I think CCGs though need to be aware that if they are funding services, they need to help them.
Yeah, absolutely. It should be commissioning consideration.
Or to enable them via a partner, or to have their own N3 connection, because I don't think CCG is really aware of that.
No, yeah, it is something we have flagged to CCGs, because in adult IAPs they were commissioning maybe one person who's got they don't even have a laptop, and they're commissioning IAP service to them. And as part of the consideration should be, how are you going to be able to allow this service to electronically record the data, get it in a format that's submittable. So I think CCGs are becoming increasingly aware of sort of the information requirements as much as the service requirements. I don't see that dramatically improving overnight, but there's certainly a role for the HSCIC to notify commissioners, and we do have commissioner events where we can raise these concerns. So if you drop us an email and say that is a local concern, we can certainly get a picture of the current position and we can take that to local commissioners. In terms of N3, we do have an N3 help desk. I'm not an N3 expert, but there is people in HSCIC who are. So there's a lot of... Was that through Navin or...?
No, just kind of, from your last presentation that I was at, you had some guidelines about how to get an N3.
Yeah.
So I tried to follow some of that, didn't really understand it, then had to go through various hoops, and then sending stuff to the extra help desk, and then coming back saying, you need to do this, blah, blah, blah. And then I found Navin and had a chat with him, because when I got to the logical connection architecture planning, which is, this huge thing that your IT department does, me. I didn't know how to do it, so I did the best that I could, then spoke to Navin, and he helped me with the bits that I didn't understand. Yeah. So hopefully we're just one step away now from getting it.
Yeah. Well,
it's a huge task, and I think maybe third sector organisations think, oh, it's just an internet connection that's quite easy to get, but you have to go through so many procedures in terms of the information governance toolkit, which isn't mandatory at the moment, but it is going to be mandatory.
Yeah, that is quite a long process.
It's massive.
It does have its internal benefits. Certainly, if you can do it once and you've got the benefits to go long term, then if you can submit the data, you know, national reports, this iView interactive tool, there is benefits locally to arranging these IG concerns.
Completely, but I think organisations will need support, maybe a bit more support with it to get to that point.
Yeah, absolutely. Well, like I said, if you could raise it as an email so we're aware of the concern. Again, resource-wise, we can see what we can do to provide some national guidance. The N3, again, I would recommend contacting the N3 service if that's the concern, because there are a number of different N3 options. I know there's sort of N3 aggregators now where suppliers or other NHS trusts can share their connection for a lower price. So there is a range of options there, but I wouldn't necessarily say I'd be able to necessarily advise on. In terms of accessing the portal, we do allow, we've tried to be flexible and allow the data set to be actually submitted by someone containing activity for someone else, and there's data items in the header table that allow you to say who's actually submitting the file and whose data does it actually belong to. So we've tried to be flexible and allow different scenarios to to be arranged locally.
Are you going to give some more context for the errors that you get? Because it's very frustrating when it says it's in one table, not in the other, and you look both ways and there aren't any. Particularly when there's
So is this the feedback you receive on the portal?
Yeah.
Yeah, so what we're trying to do now is we're trying to write a guidance of how to navigate through the warning messages. Because if you submit a file, you might have lost 80% of your records and you might have 1,000 messages to go through. So what we're trying to do is write a guidance document that tells you how to best navigate, because you might have an issue with your patient and you might lose that patient from your patient table. The knock-on effect is you've lost all of the surrounding data for that patient. So for one error in your patient table, you might have triggered another 20 errors just that results from processing after. So what we're trying to do is we are trying to write a guidance to say, you know, look at this is the order that the tables are processed in. If you work through the warnings in that order, you know, doing one job now might save you 1,000,001 jobs further down. And what we're trying to do as well is allocate some resources to amend the portal feedback report to be more of a hierarchical. So if you have got an error in your patient, you've got another 100 records because of that, they'll sort of be embedded so you can see what the parent issue was. I can't promise any timescales for that, but it is on our list to do. So
we're getting down the duplicates, but we read it again and got a completely different load of errors.
Well, that's it, like I said, you can amend one thing, you can amend your patient, so your patient starts flowing, so you fixed one error, but when it gets to the referral, you might have another error in the referral that it didn't check last time. So, you know, I would recommend submit, fix, submit again, fix, submit again, and just hopefully the portal's processing fast enough to allow you to sort of do that in the submission window.
Well, I thought I was doing well when I got down to 4,000, but
yeah, and
it improved it.
Like you said, it's never going to be perfect, and if you're aware of data quality issues that you just haven't had time to rectify, if you let us know, when we come to report on the data, we've got an executive summary that's got data quality caveats, so we can do that at provider level or a table level. So if you provide us with the detail, then we can certainly make sure that's reflected in our measures. Okay. And in the next couple of months, our data quality team are producing a data quality pack that will go out to every service that's submitted data. So that's much more detailed than you get on the portal, and that compares data not just within the actual file for that month, but also across periods as well. So if you normally submit 1,000 patients, and you have done for the last 12 months, and all of a sudden you only submit 200 patients, we'll flag that as a consistency measure. You know, it's a big drop-off. Is that intentional, or is that something we need to be aware of when we're analysing? So that'll probably be available in the next 3 or 4 months. And that'll go out to anyone who's actually registered on the portal.
Is that enough for now? Have people got any outstanding questions that need to be carried over or talked about?
Yeah, my question from here more so every one of the dashboards, some things and so on. I mean, what's the outcome of the submission of the information at HSCIC? Where would be some dashboard or something like how we doing well or something like that?
Yeah, so like I said, the first products are going to start submitting our data quality reports based on your file. So you'll be able to compare yourself nationally to see, you know, what your postcode completion rate is compared to all of them in your local area. So a lot of the focus is going to be on data quality, and we'll eventually develop our publication, you know, measure on measure, and that'll, you know, every month we'll probably add new content, and we'll have user groups to see, you know, is this measure useful locally, is it better off in a commissioner pack? And the dashboard will come at a later stage as well, this iView tool. I'm not sure exactly what the timescales are with that, but the intention is that all of the data will be in the dashboard. You can create local dashboards. If you've got 3 or 4 local services you want to compare yourself again, you can create a grouping that just compares them. So there'll be a lot of functionality there as well. So I can't go into too much detail with the tool because I'm not exactly sure where it is in terms of development, but if you emailed our inquiries, someone in our team, in the analysis team, will be able to talk about it in a bit more detail. And there's always the opportunity to get your feedback into the development as well. So the quicker we sort of act, the more functionality there to start with.
I wonder whether it'd be something, Alex, to think about for a future event, whether we could have somebody, a colleague from that department do a
Yeah, absolutely,
follow-up on
yeah.
this.
At a recent HSCIC Open Day, we demoed the iView tool with the maternity data, and that went down really well with sort of CEOs, clinicians, software developers, and it went down quite well.
Yeah.
So that is the long-term sort of intention. So we can certainly get a demo at a later event, maybe.
Lovely.
Yeah.
Alex, did you have one last question?
No, I think it was just answered in that. I did have a question about the data access request service. For a nationwide extract, is the delay for that on the data the same as the local extracts? So are they available at the end of the month? And maybe this is a question for...
Yeah, I'm not too sure what's actually available. I know that a lot of organisations who wouldn't get the data directly can apply to receive the extracts at a sort of a low, I don't know how low the fee is, but there is a fee associated just for the production. I don't know whether that's sort of an annual extract after every year,
Right.
or whether they provide sort of a monthly or quarterly service as well. But one thing I'll circulate afterwards as well is a link to that DARS Data Access Request Service webpage, and there's a lot of information there about the way you go about applying for that and what sort of what the fees are, what the justifications are for accessing the data, and I think there's options for whether you want a sensitive or non-sensitive extract. So whatever you need locally, if you let them know, they'll be able to tailor the extract to meet your needs. But that sits outside of our team.
Okay, I will email inquiries.
Absolutely, yeah, I would recommend that. Yeah.
Thank you.